Hey, nice to see you, Rejoe. We're doing a
Thank you.
little bit of an interview today so that clients can get to know you a little bit better. I've got some questions prepared. Feel free to
Mm.
expound on anything. And yeah, let's get ready to roll.
Thank you so
Welcome,
much.
Rejoe. So first question to you. Tell me a little bit about just generally who you are, kind of your name, your position, where you went to school, how long you've been a counselor at No Fear.
My name is Rejoe. I'm from the very south of India. I'm from a place called Kerala. Not sure if you know the running joke. The running joke is most of the Keralites are in the Gulf. And true to that stereotype, I grew up in UAE. I did my first master's in clinical psychology back in India, from a place called Bangalore. I worked there for close to 2.5 years as a therapist and moved to Canada in 2018. Did my second master's in counseling psychology and working here as a therapist from 2020 onwards. So close to 7.5 years of experience. And I use modalities like EFT, cognitive analytical therapy, CBT, and I do a lot of somatic work. So that is the way in which I see my clients. We'll talk more about it. And a personal friend, I'm a father. I have a daughter who's 18 months old, love of my life, married. That's me in the gist.
Thanks, Rejoe. And how long have you been with No Fear Counseling?
I believe I have been with No Fear Counseling from 2021 onwards. One of my friends who was working here referred me to No Fear Counseling, and then I became a contractor. And then eventually, when the employment program started, I became an employee.
Great. And where do you work out of for in-person work?
For in person work, I work out of Burnaby Square office, the Burnaby office of No Fear Counseling. Yeah.
Yeah, and I believe that's where you're at right now.
I am there. Yes, this is
That's
where
right.
the magic began. I believe the magic of No Fear Counseling. I believe it began from this room.
That's correct. And yeah, this is where the magic for you happens when you're working out of that room. Yeah.
That's true. Yes.
And tell me sort of like the inspiration behind how you chose counseling as a career. You said you've been doing this for a long time. You've obviously, given that you had to come here and do a second master's, it sounds like this work was really made for you. But yeah, just kind of a little bit of background zooming out. Like, how did you choose to do this work?
From a very early childhood onwards, I wanted to be in a field where I was able to create a sense of emotional healing for people. And there's a reason behind it. There's a reason behind it, a very religious reason behind it. I wanted to be part of that space. So as I grew up, as you know, as we grow up, the dreams and things change a bit. So I thought, why not becoming an engineer? That was the route. All my classmates, all my friends were becoming engineers and doctors and nurses at that point in time. So I thought, yeah, that is a space even for me. I wanted to become a marine engineer. I went for
What
my
kind of engineer?
a marine engineer.
Oh,
The
marine engineer. Got
marine
it.
engineer. Yeah, yeah. I went for that course. And I cleared the first level of interview. The second level of interview had the eye test. They test you to see if you're colorblind and all that. I was colorblind. I am colorblind. Red and green comes very close. It's going to be a challenge for me. I did not know that until then. So then I
Okay.
went back to my home and I took a year off. In that space, I started evaluating what I wanted to do, and my brother recommended, that, why don't I go to Bangalore and do a course called in English journalism and psychology. So that's where it started. That was my first exposure to psychology. I had two amazing faculty members there. They saw a lot of potential in me. We had many conversations. I fell in love with psychology and I went into the clinical psychology field. So back in India, it's different. Clinical psychology and counseling psychology is different. Clinical looks more into assessments and all that, and counseling is more of the work that we do, especially the master's program. So I went for the clinical psychology program. But when I was doing that program, I realized that I love being with people, having conversations, going in depth with them rather than just doing assessments. So while I was doing that master's program, we had a team come from UK. They trained us in cognitive analytical therapy, and another team came in from Canada and trained us in Satir, family therapy. So I took that. Then after my master's, I moved into counseling work. And then 2018, I was planning to leave India and, I was looking at other opportunities. I got an opportunity here in Adler University in Vancouver. Came here, did my second master's in counseling psychology, and that's a space. That's where I'm at. Yeah.
So we can blame your color blindness for switching you from a marine engineering pathway to counseling and
Yes,
yeah.
we can blame the color blindness, but you know what? Ophir, I got to be very honest with you. I'm so glad that happened. I find a lot of joy in the work I do.
Right.
So I'm quite glad that I'm not on the ship. I
Mm-hmm.
probably would have made slightly more money, I think, but I'm so grateful at this point in time where I am at. Yeah.
Yeah. Well, you're still early in your career. You're still a young man, so maybe you'll still catch up to the financial elements of being a marine engineer. So, what are some of the most common reasons that people come to therapy specifically with you? Like, what are the most common things that you hear from clients that seek you out or that you have like an affinity for helping?
Some of my specialization includes seeing couples, but also individual clients who have anxiety, depression, addiction. That is one of my specialization, and trauma, complex trauma. I see them. So usually when a client comes to me, I divide therapy into three aspects or three parts. So the first part is what I call as scaffolding, where the initial the anxiousness or depression symptoms. What can we do in the moment to reduce those symptoms? The second part is trauma, where I go in depth to see where this has actually happened, right? Where if a person is feeling anxious, where the person felt anxious initially in their lives, in the early childhood. So I go to that kind of work, I do that in depth work. And the third part is resilience building, seeing what's your purpose in life, what's your meaning in life, and that's how we wrap it up. So clients comes to me because they have concerns with anxiety, depression, grief, addiction, or issues in their relationships because of the attachment concerns. So those are the few areas that I look into.
Great. And what can a prospective client that wants to work with you, what can they expect in a typical first session? And,
Yeah.
do they need to prepare at all, or would it be helpful at all to have any preparation, or even what should they know in advance before starting?
I would say come as you are. Come as you are. I work hard to make sure that as the space is created for you to feel accepted without being judged. Because any behavior that they do or any concerns that they're having is usually a trauma because of the trauma and the things and the pain that they have been through in their life before. For example, if a person is having an addiction concern, addicted to certain substances, that is a coping stance, and that is not the problem. The problem is the deep trauma and the pain that the person has gone through. So I would suggest come as you are. It's not going to be pain-free sessions. There are going to be moments when there are tears. There are going to be moments, when you feel the intense pain within the session, right? And it's not that I want to create that pain for you. It's just that we're exploring that pain together so that it heals. We're looking at the pain that has been suppressed because whatever has been suppressed will be expressed in ways and in times that you don't want. And therefore, we go to that space, we look into those pain points. So there will be pain, but rest assured that there won't be a judgment. And come as you are. You don't have to prepare. You come as you are, and we'll work together.
Great, thank you. And that leads me to my next question is like, what would therapy look like with you? Like, in other words, like, how would you describe your unique counseling space?
So I use 3 to 4 therapeutic modalities, a combination of 3 to 4 therapeutic modalities. One is emotionally focused therapy combined with
And just
somatic.
let me ask you, let's zoom out a little bit before we get to the modalities, because clients might not know much about that. Just in layman's terms, like if a prospective client was to ask you, like, what would it be like to work with you in general, right? What would you tell them?
I will tell them that there will be moments I ask you how you feel and how that sits on your body. We will sit with your body, we'll hold a pillow, we'll sit with that. So that is some of the things that we will be doing. I'll be taking you through, okay, where did this, if you tell me that you have been feeling anxious, we will dig deep into finding out eventually, not immediately, but eventually we'll dig deep into finding where it started. So you will find me asking questions about your initial caregivers, school days, pain points, those aspects you will find me asking. But that will be the second part of the therapy. The first part would be to see how to reduce those symptoms immediately. So there'll be some solution focused approach at that point in time. Yeah.
Can you talk more about that in scaffolding, kind of symptoms management, just in general, like what can clients expect that the space would sort of entering the space, what would that sort of look like, feel like for them?
So when it'll be non-judgmental, as I mentioned, and when they come in, for example, let me give you an example. I think that would help. For example, if a client who comes in with anxiousness, and I was sitting recently with a client who was having this panic attack, right, Anisha, and that was the first sessions that we were sitting. Panic attacks where there's palpitation of the heart, right? And the client comes in, we sit down, we talk, and then we talk about the time he felt the panic attack the last. And so when we were talking about it, his body started showing those symptoms. His heart palpitation increasing, sweating a little bit happening. So then we noticed that, we sat with that. And the scaffolding technique that I used at that point in time, I asked him to go to the restroom, put his hands under the cold water, and place it over here and over here. And so that immediately, and I asked him to do it a few times. So those are the techniques that I would say as scaffolding, or the 5, 4, 3, 2, 1 technique, where I sometimes take the clients outside the office, not too far away from the office, just outside the building. And we ask the client to look into the 5 things that they can see, 4 things they can hear, 3 things they can touch, 2 things they can smell, and 1 thing they can taste. And when they do it, those symptoms reduces. So if a client is coming to me, the first thing that they can expect is we will work on symptom reduction.
Got it. So it sounds like it's really important for you to make sure that the client feels safe with you and that they can start to have like lessened symptoms, but a lot of it is through the relationship that you're initially building with them. And then you're starting to make certain suggestions, certain strategies and techniques that they can implement in the moment with you. That's sort of like the initial part.
Yeah.
So
and then after which we will, as I said, the second part will be trauma informed. So we will be going into seeing where it came from. But that's the second stage of sessions. Yeah.
And what does progress look like to you? Obviously, generally speaking, not for specific clients. Like how do people know that they're getting better in therapy? I'll leave it there. Yeah.
I'm smiling because a few clients in the past few days, we were having conversations, and these are the clients that I have worked with for 17, 18 sessions, and now they're like, Rejoe, when I turn back and look at the first day and right now, there's a huge change. So what would look like is the symptoms as such you would not. So you'll have more self-realization as to what causes you to feel certain way, right? And for me, that is progress. That is healing. When emotions are within your control to a large extent, right? That is progress for me. Where certain things don't trigger you, where you feel emotionally free to go to certain spaces that you would not have gone before because you felt those spaces would trigger you, and now you're comfortable going to those spaces, going into meetings, and not feeling anxious about the presentations.
Right.
Those aspects I would see as healing. That's progress. So self-realization, symptoms reduction, and the things that triggered you before not triggering you right now. Those are the 3 things that I would say indicates progress and healing for me.
Right. Yeah. So there's 3 different elements, right? Like you're saying, awareness, the ability to kind of things that used to trigger you don't trigger you as much anymore, and then the ability to go into emotional states, feeling like you can overcome things that you couldn't before, like the ability to move through things that were more difficult before.
Absolutely. Can I add something to that with your permission? So usually when that happens, then most of my clients then work towards what's a purpose and meaning in life. Because until then, the trauma and everything.
It's like actualization, spiritual sort of space.
Yes. Because until then, they are worried about the immediate environment, what is happening, the pain that they're experiencing in their body and everything. But when we heal that, when that space goes where they feel safe, they feel heard, and those trauma points are gone, then just like a plant that grows, they're like, what is my meaning in life? When I'm on my deathbed and I turn back, what do I want my legacy to be? They're working on that.
A common question is, how do I know that my counselor is a good fit, and how long does that take? How would they know, let's say at the end of a first session, what about the counselor or what within them signals that this is the right person to continue to work with?
That's a very good question. I would say the first session, if you feel you are being targeted, or if you feel you're being belittled, or if you feel the therapist is not taking you seriously and the therapist is zoning out, those are the things I would say, is an indication
Those are
that
clearly not a good fit. And then
not a good fit.
what would they look like if to know it is a good fit?
If it's a good fit, you will feel heard. You will feel that the therapist had a level of empathy towards you. However, even then, you might find it a little challenging to come in for sessions. Not the second time, but probably the fourth time. That is not because the therapist is not a good fit. That is probably because therapist has touched a trauma pain point within you and you don't want to face it. And that is also okay. When I say a person does not want to face it, I'm not saying it in a concerning manner. I'm just saying that's the way the person copes at that point. But basically, the person needs to feel that the therapist has empathy and he or she is being heard.
Yeah.
And that's the
Those are
important part.
important. Yeah. So being heard, kind of feeling like empowered,
Yeah.
sometimes uncomfortable, you can almost say overwhelming, but in a good way.
Overwhelming, but in a good way. Absolutely.
So what is your philosophy about change, or how do you see healing occurring in therapy or elsewhere as well? But what needs to happen in order for people to heal?
More than what I think, the research is very clear about it. So I'm sure you know about the research where they're looking into different modalities and seeing what caused the best change in clients. And they came across that I think around 60% was because of the therapeutic relationship.
Mhm.
So being with the client, meeting the client where the client is at, that has that has helped me see progress in the client. In the initial days of my sessions, I was like, hey, this is what the theory says. So this is the next question I should be probably asking. And then I found that the client was not engaging and the client was feeling, a little distant. But the moment I'm like, what, wait a minute, I know all these theories. Let's put that for a hold. Let me stay with the client. Let's just stay and reflect with the client. Let's stay with what's happening right now in this moment, in this present moment, what's happening as the client is speaking about the past. Then the client became engaging and then the changes started happening. I'm not saying theories are not important. Theories and everything, but I love theories. I love talking about different theories. That is an area that I'm passionate about. But what creates change is an empathetic, genuine connection that the client feels from the therapist.
Yeah, so it's very much connected to what you said earlier about it being a good fit. They leave feeling like they are heard, they are understood. That's a huge part of it, and that forms this relationship between the two of you, or at the beginning of it.
Absolutely.
How many? One of the most common questions we get from prospective clients is, how many sessions do I need to meet my goals in therapy? What's a typical range, depending on, you can break it up into like, depending on the issue, but yeah, what's typical for you in your experience?
So usually, just like you said, it depends on the issue. And it depends on the complexity of the trauma that they have been through and how they have perceived the trauma. But I would love to see clients like once in a week, back to back for 4 to 5 weeks, right? 4 to 5 weeks. That is where the scaffolding work happens. Then I usually see them once in 2 weeks. And that usually goes for the next 6 sessions. But if there are more concerns, for example, I'm working on the trauma and the pain, I have created the treatment plan by the end of the 4th session, and I'm working on it, but something presently happened, then I'm not going with the treatment plan. I'm putting that aside and staying with the client, what the client brings in. So at that time, the sessions go more, right? So, and that's usually what happens in the second phase. The second phase would take 6 to 7 sessions, but that is once in 2 weeks. And then the third part of resilience building and also understand the purpose in life. Usually we start with once in a month and then we go once in 3 months. And then I have clients who come in regularly at once in 4 months just for a check-in.
Right.
Just like you go for a family doctor visit to check in, they come in, they check in, they go back. Yeah.
Yeah, so you actually answered a great other question that I was going to ask, is sort of frequency and the timeline of a client, the whole timeline from beginning to end. So in total, it sounds like you're saying for typical cases, it could be around 20 sessions. And by the last half, you're coming in, or the last third, you're coming in on a monthly basis.
Yeah.
Something like that.
Absolutely.
And that's obviously just a typical outline. The more trauma, the more it could be, the more things coming up in the person's life today, we're addressing those as they come up as well.
Yeah. Absolutely. Yes.
Yeah, I think that's a good starting point just for clients to know if sharing like I know you mentioned your daughter, what are some hobbies that you like to do when you're not, doing therapy 24/7?
I love barbecuing with my friends. I do that. I love going for regional language movies. I'm also part of a church, so taking care of the church activities is something that I enjoy. The best thing, if you ask me what's it that I love the most, I love sitting around with a few of my friends, just chatting, having a cup of chai, and just talking about anything random that's coming to our minds.
Amazing, yeah. What's been your favorite movie that you've seen in the last 6 months?
In the last 6 months, I saw a regional language movie. I'm from Kerala, so it's a Malayalam movie. It's a Malayalam movie that I watched. What was it? It's called Chatta Pacha. Chatta Pacha. It's more of a few group of people trying to bring WE to our home province. It's a story based on that, loosely based on.
Right. Do you have a favorite genre of movie or show?
I love thriller, comedy. So these are the two genres I love. I love comedy a lot, and if I'm not watching a movie, I love to see stand-up comedies. There's this comedian. I can't recall his second name. Ashish or something like that.
Oh yeah, I know who that is. Yeah.
Yeah.
Yeah, South Asian, yeah. Great. Well, thank you so much for this insight. For anyone watching, if you have more questions for Rejoe, feel free to put it in the comments. If we get enough of them, we can always do a round two with a little bit more in the weeds, more deep dive kind of into Rejoe's world and the way in which he does his counseling, and maybe we'll get into depth into some specific kind of client success stories and things like that in the next one. Well, thank you so much, Rejoe. I really appreciate your time, and I think this will be really great for clients interested in working with you.
Thank you so much, Sophia. Thank you so much.
All right, cheers. We'll see you next time.
See you next time.